Hi everyone, Dr. Chiam here from Ensoul Medical. So let's talk a little bit about peels, things like chemical peels, home peels. The basis of peels in beauty goes a long way back, even back to the Egyptian era. And very famously, Queen Cleopatra during the Egyptian times used milk baths as part of a beauty regime. And the basis for the milk baths is basically that the milk actually contains lactic acid. Lactic acid was one of the first peels that was probably documented to be used for beauty. And lactic acid has wonderful properties in terms of hydration of the skin as well as exfoliation. So in general, peels that we know of, I broadly divide peels into home peels as well as medical grade peels. Home peels are basically products that you can probably buy over the counter. They have very low concentrations of acids in them. These are very good actually as a daily exfoliation sort of regime, and it also helps to restore glow to the skin. But of course, home peels are not quite as strong as medical grade peels. Medical grade peels are what we do in clinics. And for the medical grade peels, we do divide them into superficial peels, medium peels, as well as deep peels. Generally in Asian skin types, we are not so inclined to doing medium and deep peels these days. So a lot of us, most doctors, we tend to stick to superficial peels these days. So who will benefit from a chemical peel, and what kind of conditions can we use chemical peels to treat? So a very common indication that we use chemical peels for is just simple rejuvenation. Chemical peels have the effect of exfoliating the skin as well as rejuvenating the skin. It basically removes dead skin off the skin surface. It stimulates your skin to renew, and of course, when your skin exfoliates and your new skin definitely looks younger and brighter, more glowy compared to the old skin. Another common indication that I personally like to use peels for is acne. And I typically use a salicylic acid peel for acne patients because salicylic acid has the effect of going into the oil glands and reducing oil production, so that's very, very useful for acne patients. In patients with acne as well, the salicylic acid helps to relieve the blockage of the pores as well as renewing the skin so that the tendency for the pores to be blocked becomes much less. And so these are the common indications that we use peels for. Previously, before we had the more advanced lasers, these days we used to use deep and medium peels to treat things like wrinkles and acne scars. But in Asian skin, it tends to cause problems like hyperpigmentation and poor healing. So we have moved away from deeper peels such as TCA or trichloroacetic acid peels. These tend to have a lot of downtime for patients, especially in Asian skin, and it causes complications as well. So who is suitable for peels, or rather who is not suitable for a peel? There are some patients that of course I would absolutely not do a chemical peel for. These include patients who have had previous allergic reaction to a component of the peel, patients who are very, very sun damaged, or patients who cannot adhere to a strict sun protection regime, as well as patients who have had a history of skin infection or viral infection to the skin. These are patients who should not explore a peel. So peels are actually just one of the few treatments for acne out there, and it's important to explore with your physician which treatment is most suitable for you and whether peels are an option for you at all. In general, peels have very low downtime, especially if we do superficial peels. Most patients just get a little bit of redness for maybe about a day or so, and over the next few days you'll find that the skin is a little bit dry and exfoliating over the next 2 or 3 days. It's advisable for you to be adherent to sun protection and try not to overexpose yourself to the sun after you've done a peel. So I hope that answers some of your questions about chemical peels. Do drop in for a consult. We'll be very happy to share with you more and see whether chemical peels are actually suitable for you.